Well, let me take a look here. I'll share what I've got. It's not fully updated, but that's okay. The truth of the matter is we typically end up veering kind of far away from what is in fact the agenda because we encourage you strongly to go ahead and share your questions. I know my attitude always has been if you have questions, it's because it's something you need to know. And if it's something you need to know, I would rather get to those first and the PowerPoint later. So let me see if I can share what I've got. I know, Darren, you know that my internet isn't 100% reliable. So we'll see if I can end up keeping it going. That's my hope.
Sure.
Yeah, we shall see. I apologize while I'm getting the slideshow going. Now you may end up seeing, and if you do, the slide and one additional. As long as that's not too distracting for you, I'm going to leave it that way because very honestly, I like seeing what the next slide is that we're going to cover. So long as no one objects to that, I'm going to leave it kind of in that format. And oddly enough, I have two screens, and on one screen, all I see is the one big slide, and on the other screen, I see one slide plus the preview of the next one. So, not sure how to make it sync. All right. What do you think, Darren? Shall we begin?
Sure.
All righty. So if you're here for documentation training, you're in the right spot. I've had folks ask me, does this differ from golden thread training? It does. This is a lot more of the practicalities of foundational community supports, kinds of documentations and a variety of things woven in that we think will be helpful to you. So welcome. Glad you're here. My name is Dawn Miller. I'm a supported employment program manager for the east side of the state of Washington, and have kind of a boatload of experience in doing what I'm doing. I'm old. What can I tell you? Darren, how about you?
Hey, everybody. My name is Darren Paskey, Support Employment Program Manager for Western Washington. Together, John and I conquer the state in terms of providing training and support for support employment and fidelity. So I too have over 30 years experience providing services. So definitely we encourage folks to, if questions come up or thoughts, please share them in the chat or bring them up. Unmute, raise your hand so that we can ask them why they're kind of still fresh. I think that's important. I found out that other people in the group usually have some of the same questions. So please feel free. We want this to meet your needs and your questions. So I'm glad so many people can make it today. I'm going to try to add the PDFs into the chat, today's presentation. So
Thank you,
wish me
Darren, for
luck.
doing that. So we've changed, for those of you that have attended our webinars before, we've changed things a little bit. Um, Very honestly, we're having a change in team composition and size. And because of that, we needed some efficiencies. One of those, which I think, actually both of them, I think work out really well for you. One is that when something is recorded, we used to send out the YouTube link. Now what we let you know is to give it a couple of weeks, enough time for things to be processed, and then the YouTube link or the video will be on our YouTube channel. If anybody needs some assistance finding that YouTube channel, we can probably put that in the chat box as well. I apologize for my cat. Um, the other thing is that we used to also send out an email and say, thanks for attending, here's materials, that kind of thing. Now, instead, what we do is put the link to them in the chat for the PowerPoint and if there is anything else, with the idea being you have immediate access. If for some reason you did not gain access, we can sure try putting it in the chat again, or you can reach out to us via email and we'll send it to you that way. But part of the intent was to be more efficient. And what I'm hearing so far is it's working. So a couple of changes. Darren mentioned, excuse me, either unmuting or putting your questions in the chat. One of the things we'd like to know um, is sort of your level of understanding of documentation in general, not necessarily Medicaid documentation, but just documentation in general. Have you done this for a while? We'd like to get kind of a gauge of the scope of knowledge in our audience, from beginner to all the way through or exactly what, because we'd like to sort of gear some of our comments to that. So feel free to use the chat. Darren, I don't have your updated link in here, so maybe, or the slide in here. So that may be something, if you could put it in the chat too, would be a good
Yep,
thing.
I just did that.
Oh, bless your heart. I should have known. Silly me. You're always way ahead of the game. So when I mentioned this isn't going to be just Medicaid, we're going to talk about, at least briefly, a variety of documents. Some of them supported employment related, some of them supportive housing related, some of them related to WellPoint or, a little bit of golden thread kinds of things here too. So Darren updated a slide that does a link to each of these documents that are shown here. And then also has the pathways to employment, pathways to housing, and ipsworks.org website links. The idea being that when we send out a PDF of a PowerPoint, all of a sudden all the links go away. They're not usable. And we typically do try and use a PDF because then it can't be changed from what we sent out, which is why Darren very kindly did a separate slide with all the active links and put that in the chat for you. Darren, you want to do the next one? Oh, maybe one more.
This is funny because we were just talking about this slide yesterday about risk management, and good to see. Thank you to those folks who put in the chat, whether you're new or have some experience working with the FCS program or social services. If you're new, very welcome. Thank you for your passion for this. And for those folks who are a little bit seasoned, thank you for the longevity. It's harder to see that these days. So really appreciate you guys sharing some of the stuff in there. So a lot about documentation, my perspective when I was running a program is about risk management. I always came from the perspective of, organizing information that's accessible for my team, for the rest of the team. I worked in an agency that had an EHR system that multiple people could access, from case managers, therapists, doctors, the nursing team. And it was always important that people had up-to-date information. And it's also really important to understand what documentation is, particularly in the case of FCS and Medicaid. It's documentation that allows billing for the services. So you want to be accurate in terms of the information that you put in, and that it's accurate with all the required Medicaid pieces and the coding for that. Definitely some things that we've seen come up is that providers want to subcontract or supplant services, FCS services, with another funding source. Medicaid does not look favorably upon that. You want to be very careful, particularly if you're an FCS provider and a CRP, community rehab provider, with DVR, that you want to keep those services separate so you don't have an issue or that it looks like you are billing separate funding sources for the same service. Donna and I are very passionate about data collection, and with our new WellPoint contract coming out, we're looking at trying to collect more data and help people implement data tracking systems. So we'll be talking about ways to do that. And if you're just starting a program, this is a great way to download some of the tools from the IPS Center, or reach out to Don and I for that, or visit our Pathways to Employment. Those links should be active on the resource slide to do that, so you can start building your library of goodies and forms, particularly the next one we're going to talk about, how do you collect that data for participants? So over to you, Don.
All righty. We hate this slide. Let me be very clear. We know there's a lot on it to read,
We're in
and we're
agreement with that.
sorry. the intent here is to show and to talk about a little bit. Darren mentioned the changes in WellPoint contracting and data reporting requirements, much more minimal, excuse me, monthly data recording or reporting, I should say, and then once a year, much. Well, no, not much. About the same stuff that they were asking for quarterly, they're now asking for yearly. But in order to get to the point where you, at the end of the year, you're not scrambling and going back and reading through records and reading through emails and reading through, this and that and whatever, this tracking form can be customized so that you use it on a monthly basis in order to keep track of what's going on. So when that yearly reporting comes up, it's all right there. Having been a supervisor of a program, having had no tracking and then going to tracking and having to report, we were one of the sites, the agency I worked for was one of the best grant sites, which is one of the 2 pilot sites for the supported employment FCS program. So prior to FCS, we ended up doing IPS and reporting data through a SAMHSA grant, so it was to the feds. And we had to have a tracking form in order to keep track of things. I tried doing it without. It's a nightmare. It takes so much more time going back and recreating than if you just keep track of it as you're going. So one of the things I will mention, and we will send out, maybe Darren put in the chat, I started working on the tracking form, updating it because this is an old version. I added a tab that says housing and put in the metrics that they want to measure yearly in there. I know Anessa, if she was here, also has a tracking form that she uses for supportive housing. But this form that we're kind of tired of needed some work, so it's being worked on at this point in time, I guess is the point. And I sent Darren an updated version, which, Darren, if you wouldn't mind plopping in the chat. Let me make very clear, it's not done, but I don't care because what we want you to do is to customize it so that it works for you. So whether it was done or not, the likelihood is you're going to change it. So just keep that in mind. Anybody have any questions about that?
Well, we also want people to use it, so adapt it to your needs. You don't have to keep it all that way. Make it useful for you and your team. When I was running a program, my team didn't embrace it. It took a lot of repetition and a lot of supervision and going over in team meetings. It's changing the culture of your program, which takes time. Definitely I got pushback, but it became a tool that was very useful in meeting contract obligations for King County, and also in case you ever have an administrative review with your third-party administrator. I had used this. I was able to track data, so I was able to give them real-time information when a former third-party administrator had worked in King County. So definitely it was not a pleasant situation, but I'm glad I had everything organized and at a keystroke that I could share to meet the needs of my leadership that was interacting with that. So definitely it's saved my program in a sling, so to speak. And it was very useful, not just for that, but just to know where the program is, who's receiving the services, where people are going out in the community. It's part of that accountability piece that I think was very helpful for me in helping align to the principles of IPS. Yeah, please make adjustments. That's what it.
Well, and I was going to say I didn't do a lot of adjustments on the supported employment side of the tracking form. Participant log is what it ends up being entitled. But the reason that I didn't make a lot of adjustments to it is because when it was developed back in 2015 or whatever it was, the fidelity items that are addressed in yellow, or the items that address fidelity are in yellow. Those items that address fidelity are essentially what WellPoint's going to be asking you to look at. Job placements, when, how long have they been there, kind of a thing. And they're already in that form, so I haven't revised that as yet. Keep in mind that with any of these documents, if you need additional training at an agency level, we can do that. If you need, additional training at even an individual staff level, one or the other of us potentially can do that for you. So feel free to reach out.
So, informed choice. This is, let's see, that's one Ron, right?
Yeah, I think so.
Informed choice. Okay, well, I saw a couple slides ago there, so I wasn't sure. Um, Really, this is that relationship we're building with folks in terms of participant, and I'll just focus on the employment side, but it's true for the housing side because many of the principles and dimensions are very similar. Person-centered services and really learning about the individual, and that takes time. But for me, informed choice, part of the role of employment is having those intentional services where if I'm saying I'm going to provide employment services, I'm going to be able to deliver in some capacity, develop resumes, look at references, skills, abilities, transferable skills, and go out and meet employers out in the community and being able to share that information. The IPS worksite definitely has something separate just about disclosure, where it's a great form that people can use to have that conversation so that you get that perspective of the individual and how information is shared. When I was a job developer, I had an agency with a super long name. So it had mental health in it. So I shared information, just sharing my business card that I was associated with behavioral health. Not everybody is comfortable with that. Some people have been traumatized from that in the past, or some people just don't like that stigma. So it might take some time. I've had people say, no, I don't want you talking to employers. Help me with resumes, help me with some interview skills. But over time, some of those strategies aren't successful in getting a job placement, and they're more open to trying new things in different ways. I've also had people go out with me to do job development so that they could see what I'm doing, so that they're aware of how their information is shared. Some people have, you know, incidents where maybe information was shared or oversharing about their diagnosis or medications or just being in behavioral health without their consent. So people are very sensitive to that, and they should be, because that's all protective information that we're working on. So just be aware of some of that with housing, going out with landlords or employment, going to job fairs or working with other partners in the community, DVR, DSHS, whatever that is, that this is part of the process to be able to build that trust with somebody so that they're aware of those actions you're doing out in the community on their behalf.
Absolutely. And I would add to that too, a couple of things. One is that, Darren mentioned there's a form within the individual placement and support works.org, ipsworks.org website, and in various other places that you can access the disclosure form. I want to just say for a minute that there are a variety of forms. And I know sometimes we get frustrated with all the paperwork. I want you to reframe. If you would, humor me. This form, the career profile, a treatment plan, whatever it might be that's a form, is not just a form. It's a guided conversation so that you don't forget pieces of things that are important to discuss with the person. So, and when I do fidelity reviews, I'll very often find a form in a file that has a couple, three things on it, and most of the stuff's not addressed, which means it was not addressed and should be. So forms are not just forms. They really are the opportunity to have a guided conversation with a person so that you don't forget anything and you get the needed information. The other piece about informed choice that I wanted to mention, I supervised a staff person who came to me one day and he said, you know what, Don, when we've been working with an employer, we place somebody there and then somebody else comes along on our caseload already interested in working there. You do realize we've already outed them in regards to working with a behavioral health agency by virtue of bringing that up, with the prior person. I thought, holy crud. No, I didn't consider that. But yes, he's right. So be very intentional about what you share and with whom, not just for the person or not exclusively for the person you're working with right at the moment, but for anybody that comes after them that might want to work with the same employer that maybe doesn't want them to know that they have a behavioral health issue. it's a wrap your head around that one. Man, I still don't think I have. It's a hard thing to figure out how to do that intentionally without outing every person behind them. I don't know if that makes sense. Hopefully it does. Oh, and let's see if the slide will advance. Come on. Oh, there we go. I hope I didn't go one too many. So we're going to talk a little bit. You'll see on the left there it says WellPoint contracted services. And there's a question that says, how will you document each? Um, WellPoint doesn't dictate, we don't dictate, IPS Employment Center doesn't dictate what your treatment plan should look like exactly. You know, there's components that have got to be in all of them. Doesn't say what your progress note should look like. Doesn't say, you know, just what a variety of things. Even all of the IPS forms, you're welcome to download from their site and make them your own. I know some people have really shortened the career profile, which I kind of hope folks won't do, because it is a lot of important information that's intended to be gotten over 2 to 3 sessions. So it's not a form that you're supposed to complete in one session. You're supposed to complete the career profile over 2 to 3. But there are a variety of those forms that you can make your own. How are you going to document each one of these contracted services? Job-related discovery or assessment, that vocational profile or career profile, and taking the time to do that, why rush through it? It's a billable service, and it's an important component of getting to know the person on your caseload. The better you know the person on your caseload or the job seeker or student, if that's what they're going to be, the better likelihood there is of you making a good job match or school match. So that's, you know, first and foremost, the first thing you're going to try to do is get to know the person. There, I don't remember, we actually talk about a lot of this stuff later on, don't we? So maybe I don't need to go into as much detail. Person-centered employment planning. I would hope that any planning you do with a person is with them present and with them centered. I had a gal on my caseload years ago say, so it's like you're the GPS and I'm the driver. I said, that's perfect. I can suggest a route. That doesn't mean you're going to take it. And if you don't take it, then I come up with a different route. It's a resource sharing kind of thing, but not a decision making on my part. It's on the part of the job seeker. Individualized job development and placement. I do know we're going to talk more about that over time. Job carving and customized employment. Is there anybody that's totally unfamiliar with customized employment or job carving? Everybody kind of know what that is. And Darren, I can't see the chat with my screen share, so you'll have to let me know what folks are saying.
I will. Thumbs
Okay.
up from Brittany. So there's a couple of people.
Okay. Well, so maybe I'll give just kind of a brief, very brief overview of customized employment. We know that there's a probably small percentage of folks on our caseloads, and I say I used to have one. I don't right now, but I did for lots of years. Small number of those folks that won't slide into a traditional job description. So, you know, if it's courtesy clerk, some folks can do all the steps within being a courtesy clerk, some can't. We have some people with significant enough challenges that maybe they can do one piece of a job description, or they have a job carved for them. My best 2 examples are, one was a gal that was working with Nike over in Seattle, and she was talking to him, a job developer, was talking to him about what's the job that falls by the wayside that nobody wants to do. They had a massive box of mismatched shoes that they needed staff to take time to go and match them up. You can guess that was just the favorite thing of everybody to do. Well, it was of the guy that she was working with on her caseload, whose thing was matching. He actually started out as a table busser, put all the salts on one table, all the peppers on another, all the ketchups on a third, and got fired because they couldn't get him to do a salt, a pepper, a pepper. I mean, it just didn't work. Matching was his things. his job became matching those mismatched shoes, which was perfect for him. And it took away from the fact that the other staff didn't want to have to do it. They sometimes couldn't find time to do it. So it was a win for the job seeker, and it was a win for the employer. My other example of customized employment was an individual in Moses Lake, who the job developer had talked to Safeway and asked if the person could clean the bakery and the meat department. In the meat department, the folks there have to cut and wrap meat. They have to wait customers, and they have to clean. Bakers have to bake, wait customers, and clean. This person had no number concept, so measuring for a recipe to whip up a recipe, or even weigh out a certain amount of meat was beyond them. That wasn't something they were going to be able to do. Making change was not something they were going to be able to do. Cleaning was something that they did very, very well. Of great benefit to Safeway, because, as you can well imagine, the folks waiting on customers and producing the product get very, very busy. I am not saying that Safeway in Moses Lake is not the cleanest environment that ever there was. It just made life easier to have it be clean when they had a person designated to do that. So those are a couple of examples of customized employment. Benefits, education, and counseling is Darren's favorite, so I'm going to let him talk about that later. Transportation, only in conjunction with an authorized service. I know I saw WellPoint wording after their Q&A the other day that differed from this. So I'm going to explain this. This is what it used to say. You're not getting paid for transportation. You're getting paid for the session you conducted in the car on the way to the job interview, where you did practice interviewing on the way there. The fact that it's in a car or a bus or whatever it is immaterial. You're conducting a session. So you are not paid for transportation ever. You are paid for having a session with a person in whatever setting that might be. And hopefully that makes sense. If it doesn't, let me know and I'll clarify a little better. Building a rapport should always be what we're doing. The better we get to know a person, the more that they trust us, the more effective are our services. And so building rapport is always, always important and is a billable kind of service. Supported education. I hope everybody knows that supported education is part of supported employment. And we can go into greater detail what that looks like. Helping to identify potential barriers and coming up with solutions prior to job start. Somebody doesn't have their ID, going to be pretty hard to fill out that first day, documentation for their employer. Somebody doesn't have their Social Security card, same deal, and a longer process. So identifying those barriers and solving them prior to job starts is important. Collaborating with the support team during planning. I will say I used to be really good when I met with folks on my caseload years ago about saying, is there anybody in your life that's really important to you that's going to be part of your support? Are you willing to have them come into treatment plan meetings and that kind of thing so we can have them be part of it from the start? Pretty often folks would say, yes, I have somebody, and they'd bring them. And over time, I think I got lazy or something. I don't know what I did, but I didn't do it so much anymore, sadly, because it makes a big difference when the person feels supported by not just us, but their support team members, and everybody's on the same page. The way that the state of Washington is doing FCS, Foundational Community Supports, and therefore IPS, Individual Placement and Support, is that sometimes folks may have people that paid professionals that are from an entirely different agency that need to know about what's going on with their services. So that collaboration becomes even more important there. Inviting a TANF worker to be part of things if person's on TANF, so that it can be part of the person's individual responsibility plan with TANF in addition to the treatment plan. So we're on the same page. Just a variety of examples like that. And spending the time to do that is also a billable service. And you'll notice it says pre-employment. There's pre-employment and employment sustaining, which is going to be Darren's thing next, coming. Oh, and what do you know? The slide actually worked.
Thanks, Don. So the nice thing about FCS and IPS both is that not everybody has the first job that they get or third job, their forever job. There's a real focus on career advancement, whether it could be internally with a company or that somebody does the survival job and then we're going to help them with something that's more career related to their goals and strengths and abilities. So it's really nice to have that capacity that even though somebody might be working in a job, we can still use those FCF services to support them on their journey to more integrated into the workforce or more career advancement for that too. And an important part of FCS that we can also mirror these same activities into the school environment, helping people get orientated to the environment, help them with some of those forms, locate where the disability or student services are at, maybe help them with transportation, maybe some advocacy. To help them be successful students, whether it's note taking or something else. So you can really put a lot of things together to really make that a robust and positive experience for folks. When I've had people go to school, it was really great for those folks who are open where I could talk to, some of the instructors and do some advocacy. Not everybody was open to that, but I always like that piece to do some advocacy in that way. And on the school front or the employment part, that is how to accommodate or advocate for accommodations, look at different ways to decrease those barriers for folks. Most of the time, people are really open to things that are small adjustments to help people be successful. So I think those are important things, and there's some great resources. Jan Accommodation Network is a great resource to check into that, as well as some other ones. And maybe there might be some assistive technology. Sometimes it can be complicated. I've had people, and I've worked with DVR where they've helped put inserts into people's shoes, or something as a mat to stand on a concrete floor so that they could be a cashier. So there could be a range of options. Sometimes it might be just pulling a stool into an area where maybe somebody needs to sit, or rearrange the brakes a little bit, so that they can monitor maybe some medical issues that they might be having, so that they can be successful in the job. But it starts with that conversation, but the individual has to be the one who's comfortable, being able to share, because that's part of the disclosure. And when you're asking for one of these, an accommodation, it could be at the very beginning during the interview. Can I have my employment specialist sit in with me during an interview? That might help out, or on the actual job site where HR interaction might be very beneficial in terms of achieving the accommodation goals. Job analysis is part of that piece. Are what is going on in the job? Can you come in and just observe the job, or observe people who are doing the job very well and bring some of those changes maybe into a workplace? I had a staff that was very good at this, and she was able to go in and rearrange a person's manufacturing work environment so that they could key in on what was really important and speed up their production. Job coaching kind of goes along with that. Maybe you do some analysis to kind of see what the barriers or challenges are, and then come in and provide some support and guidance. You're not doing the job for the person, but you're providing some of those supports. Maybe you're modeling new ways that could increase the speed, or new ways to communicate. I know I've worked with people in retail, and some of the job coaching was just how to problem solve and communication with those people in charge and supervisors, and be able to track some of that information. Again, I'm passionate about benefit education because my philosophy is that we want to maintain people's benefits, change their perspective and open their mind. Maybe staying on those benefits aren't going to be the best pathway for more autonomy and independence in the workforce, but be respectful of people's choices. And it's going to take those conversations, maybe with the individual, maybe with significant others or parents. Don mentioned trying to bring people who the person identifies as important to be part of the process, and they might have other views about Social Security than the person has, or than I might have. So it takes some repetition, and discussion along the way. And then after some of these discussions, people have been working for a while, and they're like, well, I kind of like making money. What happens if I make more money? Well, we can help you transition off benefits if that is your goal, or we can also show you how you can decrease benefits, increase your income, being aware that there's going to be some reductions in some of the benefits they have. So it's a lot about communication, kind of back to the IPS principle of gaining that trust. You don't want to promise things that you don't have any power over, but to educate and provide resources for folks as well. Hopefully, through all this, people are developing assets, maybe some financial assets, maybe some skills and developments that can be transferable down the road, particularly around education, and look at different ways for ongoing supports. I always got a lot of feeling of achievement where somebody was integrated in their workforce and could rely on coworkers to ask for some information or get some support, develop those natural supports. But it's up to the individual on how long they want FCS supports. I've had people say, "It's my job now, Darren. Thank you very much. I'm out of here." But through some assistive engagement, making sure we still have some conversations just to make sure things are going okay during that honeymoon period of the first 90 days at a job. So it's really nice that FCS has that. And that's also a strength in partnership building with a division of Oak Rehab because they can come in and provide short-term resources. You can share the ongoing resources through FCS to give a really robust employment plan for your participants.
Speaking with mute off is good. I wanted to mention related to this scenario also in benefits planning briefly. Darren and I do what are called fidelity reviews, where we come in and if you're unfamiliar with them, we come in and look at agencies based on a kind of a list of stuff. I'm oversimplifying it, but one of the things that we look at is benefits planning offered. And I will often see in the forms when we're looking at the documentation for that, a person had no benefits. I'm going to tell you right now, everyone in FCS has at least Medicaid, which is a benefit. It actually annoys the holy living tweedle out of me when I see a person had no benefits. Baloney. They have at least Medicaid and they probably have SNAP and they maybe have a housing subsidy and maybe SSI or SSDI. So if you learn nothing today, well, I hope you learn lots today. But one of the things to learn is that everybody in FCS has at least one benefit. Don't say they have none, please. All right, we'll see if the computer decides to advance the slide. Come on, you can do it. Oh, there we go. Oh, Anessa's not, the real Anessa is not here today. There may be a couple of other Anessas in the audience because she had to share her link with you to get you in. But so when it says pre-tenancy supports, much like supported employment has pre-employment and then employment sustaining, we have pre-tenancy and tenancy sustaining supports related to supportive housing. I am not going to try and do the wonderful job that Anessa typically does going through each one of them. One thing that I will mention, and somebody asked a question today about a couple of the trainings that Darren and Anessa and I do. This documentation training is going to be done every other month. And, so if there are things that you feel like you didn't fully absorb today, and any of us that learn, it takes 3 or 4 repetitions to get it down, feel free to come to the next documentation training, since this is September, it'll be November. And Anessa should be at that one. If you want more information from her, you can reach out to her, potentially to Kimberly Castle, to get some information about the pre-tenancy and tenancy sustaining kinds of supports. For those of you that already know about supportive housing, maybe you could take on this piece of things. And I'm teasing just to a general degree, but I'm not going to try and do the wonderful job that she would do in regards to talking about these. Darren, you want to take a stab at it, or should we just move on?
Well, I just wanted to highlight that the supports are very similar. They might be just called a little bit different in terms of benefit supports, benefit planning. I do like they have a focus on the financial skill building and on the pathways to housing. They do have some great tools just to educate people about credit checks and maybe some guidance and some development, of a budget. And we both talk about short-term and long-term goals because all the services that we support need to be tied into that service plan or those SMART goals so that we're being accurate in terms of what we're billing for services, that we're providing documentation for the service, and it's part of the overall series of goals and interventions that we're all working together, to provide some of that. And also, as it says, there's that community development and relationship support, like employment. We're developing relationships with landlords, developing relationships with employers, very similar to all those types of things, and really focus on that coordinated care. Because when I've been doing job development or if I'm doing trainings like this, the more people I can bring in and have some specific skills and ability or insight or creative ideas, it really helps that person to be more independent in the community and look at ways, options, because usually there's some weaving and braiding going on for funding sources and for resources to help somebody be successful during a time of transition.
Absolutely. Good points. Tendency sustaining. I will say when Darren mentioned there's a lot of similarities. Coordination of care is important in supportive employment and supportive housing. Well, in life in general, very honestly, I would argue that we're not totally independent, that each one of us is interdependent, if you will. We all have some sort of support team out there, and so hopefully do the folks we serve. And if not, we help them develop one. Choice was one that I don't think we've talked about yet. Choice of a job is incredibly important. Choice of housing, to the degree that is possible, and the same thing with the job, is incredibly important. Being respectful of the person and their choice and doing as much as you can to help them achieve that is incredibly important in all things. Treatment planning, retention, benefits management, landlord liaising, and employer liaising are similar kinds of things, whether it's supported employment or supportive housing.
I think the
Thank
one
you.
unique thing is that when somebody goes from not being housed or transition housing to their own home, there's going to be some ADLs focused at. Maybe people aren't used to having, an oven or a stove or how to shop for nutritious food or to make sure things get refrigerated so things don't spoil or, pulling the shower curtain on when you're taking a shower because you may not be used to all those different things. So that's definitely one piece that's, I think, a little bit different, which is really important when you're helping people transition into their own homes.
Darren, did you ever hear Amanda Polly's story about the gentleman who'd lived outdoors for 20 some odd years, came into his apartment and there were brown polka dots on the ceiling that hadn't been there before? Did you hear that story?
No, I haven't.
Also a
I'm
very,
curious
very good
now.
story. So she came in and noticed and said, "Hi, just checking what's going on here." He was used to cooking on a campfire and cooking, like, say, a can of beans or whatever with the lid shut in case it fell over, God forbid, in the fire, and picking it out with sticks or whatever it might be, and then carefully opening it up. You don't cook a can of beans with the lid shut on a stove burner. Just saying. But that was not knowledge he had. And then Amanda was able to gauge kind of where she needed to start in regards to teaching of, different activities of daily living, including cooking. But I love that
Right.
story. She talked about the brown polka dots. It's like, huh. Gotta love it, don't you? It's
I was thinking
never
you could
boring.
he brought in branches with pine cones to make it more kind of homey.
There we
It was
go.
not a design aspect.
I I think Amanda was the same one that had, and maybe it was the same guy. I don't even remember. We worked together over a period of time, but these stories were from years ago. Um, Gentleman who was so uncomfortable about living indoors, but familiar with living in a tent, pitched the tent in the living room. Ended up becoming more acclimated to being indoors and increasing that comfort level by having the tent in the living room, which I thought was quite brilliant.
Yeah, I had one homeless individual. He didn't like keys, and it just reminds me of the key here on the photo that he didn't want anything to do with keys, so he would lose his key, which we had
Oh
to make
dear.
some copies. But he didn't want to hang on to him, wouldn't lock stuff up. It was definitely some of those things that do come up
Oh
from
dear.
somebody having, their lifestyle and then some of these other changes that need some acclimation and support.
Absolutely. Yeah. Interesting stuff.
It was worse when he would flush them down the toilet because that increased the plumbing bill, but he
Whoops.
did not like
Oh
heat.
dear.
Of
Yeah. So even us old supported employment dogs have a handful of housing stories at home.
housing stories. This is a good time then. I don't think we've had this opportunity, Don.
No, we haven't. We haven't, as a matter of fact. Um, so I mentioned fidelity. And actually, Darren, this is probably yours, isn't it?
I don't know, maybe.
Okay.
But we'll both have a piece. You go ahead.
Okay. All right. Would you guys agree that sometimes it's nice to not have to create the wheel and start from scratch? Sometimes it's nice to have a recipe to go from when you are starting something new. And then it's easy enough to figure out where you need to maybe modify a little bit and that kind of thing. So when it says assessing fidelity, fidelity to begin with is essentially a recipe. There's a recipe for supportive housing, there's a recipe for supported employment. In relationships to supported employment, the recipe is called individual placement and support. If you look on the SAMHSA website, and I think if you look up supported employment toolkit, the IPS fidelity scale will show up, the recipe. Um, actually SAMHSA also has the toolkit for housing, which is permanent supportive housing. It's the bookend for IPS. So IPS and PSH are the two evidence-based practices that we use. They're about quality. They're about continuous quality improvement. In each case, they are about a recipe that was developed and tried out and researched and studied and shown that you get better outcomes when you use this fidelity scale or recipe. So why do we assess fidelity? Why do we go into agencies and take that recipe and say, okay, number one, IPS, caseload of 20 or fewer, how are you doing? Is your caseload 40? Let's talk about that. Is your caseload 19? Yay, go you. You get kudos. Um, it's the opportunity to have something standardized that you take into a facility, have all the questions that you need to ask, have all the areas that you need to assess them. And then when we do fidelity reviews, when an agency has us come in and do a fidelity review, we give them a report that has a score for each one of the 25 IPS fidelity items. But it gives more than that, better than that. It gives recommendations, very specific. We saw you do great things here. We saw this thing that happened, and maybe you could try this, which would improve upon things. Very much individualized report card, if you will. And much like a report card, we don't take away your birthday or your money or your, whatever if you don't get a good grade on your report card. We offer more support. We offer more information in regards to how could you improve. Um, in my mind, that's some of the important stuff related to fidelity. Uh, and now it's your turn, Darren. What did I miss?
Yeah, we talk a lot of, about that recipe, and this is tried and true because it's based on evidence over decades of looking at the model and see the principles and how they relate. And some of this is still ongoing on IPS, that they're doing some new populations in terms of youth, and they're also looking at people re-entry and substance abuse. So definitely the model is expanding with some of these still core elements and how they relate to the different populations. So definitely it's a great standardized recipe. I always think of quality assurance across the board, kind of like Starbucks does, that you can go in and what you know to expect. And that's what we're trying to build here in Washington in terms of providing the fidelity so that people are using this model to really help people. Because one thing the research shows, if you use this recipe, if you use this model, you use these free resources, you will have higher outcomes. And what that really means is outcomes are changing people's lives, for the better, to make them more independent in the community, more financially secure as we're all facing challenges coming up with federal budget changes. We want to be able to instill people and empower them in the workforce so that they can take charge, of their lives and lead more fruitful and independent lives too. But definitely kind of building that community as well, because it's great to have recipes, but we also want that community, just like we are here, sharing information, sharing some ideas, and encouraging people to say, hey, here's some real free resources, not quite, turnkey, but almost in terms of utilizing the library at the IPS Employment Center, that this stuff is free and available. And it's really a treat to be able to do that and share it with you folks.
How's everybody doing? Do you have questions up to this point in time? I know Darren and I usually like to have a lot of interaction, and so far we've been doing a lot of the talking, so might just be your turn for a minute or two here. How's everybody doing? Questions, comments?
So this is probably really naive, but you said there's 25 fidelity measures,
Yes,
fidelity items. Is there a list posted somewhere on those for those?
absolutely. Good question. So where Darren did that lovely resource list and it says ipsworks.org, individual placement and support is the fidelity principle or practice, I should say, the evidence-based practice. ips.works.org is their website. They have a library of like 170 some odd documents, white papers, books, you name it. One of them is the IPS Fidelity Scale. And if you do it in their library, the search for IPS Fidelity Scale, it'll pop it up for you. In fact, it'll pop it up in Norwegian, Spanish, I think French, maybe Japanese. Yep, yep. And Teresa, if you need more help finding it than that, we'd be happy to do that for you. This is documentation training, but knowing the things you're supposed to be doing, then the next step is figuring out how you're going to document them. Like I think we both mentioned earlier when we were talking about the tracking form and a variety of other things. So does that help, Teresa? Are you looking it up? Can you find it?
Was. But I'll find it. I'll call you if I can't find it.
I put it in the chat, Teresa.
Hold you to that too.
And folks, and you can look at this, but don't think you have to do all these at once.
Oh God,
this
no.
is a process.
And please don't ever think you have to do them to the highest score, which is a 5. We'd love you to shoot for that, but do not beat yourself up if you don't get A pluses all the way across the board. I'm going to equate it to a report card again. A plus doesn't exist, but that's kind of like a 5 all the way across the board. Nobody gets it. If you get some 5s, some 4s, some 3s, some 2s, some 1s, you can still be performing according to fidelity. So
and that's normal.
Please don't hold yourself to an excessive standard on that because you'll drive yourself nuts.
Yeah, we don't want to be responsible for that.
No,
it's a good recipe.
We might drive you nuts in other ways, but that's not the one we're hoping to achieve.
That's not the one we want to take credit for.
So that's just the way my brain works. So you said going through like fidelity, it's a guide to help you get to where you need to be quicker, right?
Not necessarily quicker. Not necessarily quicker. But just in general. We expect that when agencies are new, they're not going to get a high fidelity score. That's an expectation, and it's pretty almost always turns out that way. So you start where you start and you improve from there because it's continuous quality improvement from wherever you're starting. Hopefully, as you start following the principles and are able to change those that you can, kind of meet the fidelity scale, you'll see improvement over time, but it's not a quickly kind of thing. It's fit for the long run. Does that help?
So there's things that you can pick and choose depending on kind of what the client needs, as far as that fidelity goes.
Yeah, kind of. I wouldn't necessarily put it that way. Some of it may be organizational needs. Some of it may be needs of individuals. So an example of I mentioned the agency I worked for was one of the pilot sites before the FCS program. And when we got reviewed on fidelity, the first one is caseloads of 20 or fewer. But if you look at a number 4, So if we're talking A, B, C, D, F, whatever, if you look at a B, number 4, we decided that monetarily a caseload of 25 was what we were going to need in order to, still perform the services because our caseloads weren't too high, and also bring in enough income to support the program. So sometimes the decisions are organization based. So, okay, I have actually another example. When we had our fidelity review done, and we had 3 of them done, there's an item that says diversity of employer, and then another one that says diversity of job or job diversity. We had 5 people placed at Safeway. We got counted down on that because it wasn't diversity of employer. I mean, it was added in, averaged in with all the other employment placements. But for that employer, diversity employer was not good because it says anything more than 2 is no longer diverse.
Wow.
But diversity of jobs, we got a 5 because 1 was in the bakery, 1 was in the deli, 1 was a courtesy clerk. I want to say 1 was florist. I think it was the floral department. And I can't remember what number 5 was, but it was a different department as well. Maybe it was meat cutting. So diversity of jobs, they were 5 diverse and different jobs, but they were in the same employer. So we got counted down on the 1, got a 5 on the other. Does that sort of make sense?
Yeah, that makes sense.
And it was based on the person's choice.
Yeah.
That's where they wanted to work.
Yeah. Okay, that sounds good. I get it.
All righty. Thanks for
Thank
asking the questions. Anybody else? Other questions? It looks like maybe the chat might have some, Darren, because I see it bumped up to 45.
Yeah, Rachel had a billing question that I was working on. So I don't know, Rachel, do you feel comfortable coming off mute to kind of share the billing question that you have?
Yeah, hello. And
Hi.
it's something that the FCS outreach staff just asked me about. Is kind of just they, I guess, helped a participant with getting some essential needs items because they're being exited from a shelter, and he picked them up from one of our local social service agencies and kind of spoke with them, and he's going to be dropping them back off with the client and doing some planning when they did that. And he was asking me if he could bill for that, and I told him I was not sure. and so since we weren't interacting enough, I thought I would go ahead and ask you guys because figured you might know.
You bet. That's a good question. And I'm going to tell you a couple of things to always keep in mind. Medicaid prefers that everything that's done for a person is done along with the person because you're teaching them how to do things. So if the person was along to pick up the stuff, rather than the staff person picking up the stuff and taking it to the person, if the person had gone along, it could have been billed.
Got you.
Picking it up and dropping it off, it can't.
Got you. What about, but he could bill for if when he drops it off, if he actually is planning with them and doing something with their care plan, then he could bill for that, but just not for the picking up the items. Awesome. Correct. Thank you very much. That's kind of what I thought, but I wasn't sure.
There's kind of another piece of that too. Sometimes things are sort of a stretch as far as whether they fit or not under either supportive housing or supported employment. Refer back to the slides in regards to these are the billable items under the WellPoint contract. But also keep in mind in the example that I use, let's say a person gets a job, they have no food at home. They need to have a lunch for tomorrow, or they're going to be in trouble. They're not going to have the energy to sustain the day. If I take them to the food bank, is that billable under supported employment? Now, it could be under resolving barriers. And I would say it is under resolving barriers, but I'm still going to say the only way you can truly bill it is to pull back in that supported employment piece. Dawn got a job, talked with her about putting together a lunch for tomorrow. She reported having no groceries and no money to get them at this point in time. Took Dawn to the food bank in order to get some food stuff so she can build a lunch for tomorrow so that she's able to make it through her work day. That rather than took Dawn to the food bank. You can see where one potentially could be billable to supported employment and one couldn't be billable. know, just because it doesn't have enough information. Does that make any sense? Okay, all right. So keep those things in mind too. Make it clear, and we'll talk more. So this month we're doing a documentation training. Next month we're doing a golden thread training that gets more into weaving in that medical necessity. There isn't any service that we provide we can just provide for the heck of it. And I apologize, it's a bug and I didn't get him around my face. Sorry, I'm not losing it. There isn't anything we can bill that's just because the person wanted it. It's got to be because the person wanted and needed it based on their disability. And so we've got to weave in those kinds of pieces too. And there's a whole lot more to it than that, but we'll discuss a lot of those kinds of things in our golden thread trainings that we're doing. Documentation, golden thread documentation, so please attend those too if you're able. Thanks for asking the question. Others? Okay. So Darren, I think this one's you.
Can you take that? I'm just responding a little bit more in the chat.
Okay, sure, absolutely. So when we're talking baseline expectations, that's baseline infidelity and assessing fidelity. Any agency that says, yes, I'd like to have a fidelity review done, the first one's a baseline. Like, if anybody's a behaviorist and they've done behavior plans or, listen to folks talk about IEPs in the school district or whatever it is, you have a starting point. That's your baseline. From that, you grow. And so baseline expectations related to kind of an agency starting and fidelity, we end up looking at the Medicaid documentation standards, the contract issues, the things along that line. And I think actually reading this slide a little better, I'm getting ahead of myself. Part of it is baseline in relationship to where you're starting and moving from. Part of it is expectations from WellPoint and from the healthcare authority as far as things that you got to do as an agency. And because you're doing them, what's the thing that you've heard 100 times if you've heard it once? If it isn't documented, it didn't happen. Every single thing on these slides that we're sending to you may not say it's documentation, may say it's a principle. Then you got to figure out how you're going to document it. If you need help with figuring some of those things out, we absolutely can do that. Everybody fairly familiar with HIPAA? Or at least the fact that you have to be very cautious about releases of information or don't release information, protected health information, hopefully. There you have resources with any of this. You have those of us that are the trainers at HCA. You have WellPoint, the contract managers there, your FCS managers there. You have resources. If you're working with folks that have been referred from what was ALTSA is now HECLA, and individuals on your caseload that are referred by HECLA, they are another resource available to you. So always know if you have questions about any of these kinds of things, you have people to ask. You don't have to go it alone.
I guess the only thing I would add to this, I think it kind of just in terms of we're talking about billing stuff, make sure you use the appropriate codes for services. For employment, there's 2 codes, and for housing, it's 1 because it's a per diem service, but ours is for employment is an hourly bill rate. Just be attentive to that. I've had some organizations reach out for some clarification about that, and that's all in the manual. It's all covered during the administrative orientation, but we're also available to reach out if you think are having some challenges. We don't do the billing process, but if you have some questions about that, we can help or help direct you to the correct manager at WellPoint to work through a resolution.
Absolutely, good point. And that reminds me, and I don't know if y'all have seen yet, WellPoint is starting to do a quarterly orientation kind of a thing. I don't remember what they called it just exactly. Darren, do you remember when the first one's coming up? Is it in September? Yeah, you don't.
I think it's very soon.
I think
might
so
be
too.
This week or next week.
It might be. If you have questions about that and need the information, we can look it up and get it out to you. But I will say it's going to be important to attend that training with WellPoint if you have some questions about billing and orientation and the admin stuff and that kind of thing. Because I think I've looked at the PowerPoint they put together. It's fabulous. And I want to say there were 70 some odd slides, weren't there, Darren? We looked at
I
it and
believe
went,
so.
"Ooh, crud."
Nice round number.
So yeah, nice large number. So they're just always know that if you have questions, there are folks available to answer them. All right. So Darren, do you want to do this one? I think we got
Well,
a
I just
little.
got a question because somebody asked for the date and info on the training. So that's for providers. It could be a refresher for providers who are currently contracting,
Yes.
or it's new providers that WellPoint has gone out to check, that in the contracting process. So those folks would get that. But I think it would be open to anyone. I think I would have to check. What do you think, Dawn?
The email made clear that it was orientation kind of stuff and
Yeah.
for folks who just wanted a refresher, because they mentioned the whole refresher thing, which I thought was refreshing. Sorry. It was a dad joke.
That was a nice one, yeah. Nice tie-in.
But we can forward the email as needed if somebody reaches out. And when I say reach out, don't put it in the chat. Send Darren or I an email and say, please forward to me this or that, and we'll do that. That's your most secure, guaranteed way of getting it what it is that you're asking for. But we can forward that along to you if you need it. Did that hopefully answer the question, or at least minimally? All right. So, and I bet you, Darren, you're answering more questions, aren't you?
Well, I was looking for the email from them. I couldn't find it at the fingertips. So I think, for folks who are, looking for that information that, oh, here it is. It's September 10th from 10 to 12. So
good catch.
So yeah, please reach out, email us, and we can share some of the information with you.
Yeah. So objectives. And when we talk objectives, it has numerous meanings. If we're talking a treatment plan has objectives. But in general, objectives for training, keeping it intentional. What do we mean by that? In my case, what I used to do when I had somebody on my caseload coming in for an appointment, I grabbed a couple of minutes just before their appointment. I looked at what my last note said and said what we were going to do for this time. And I peek at the treatment plan. And granted, the agency that I worked for had an electronic health record, so I could pop it up on the computer really easily and look to see what it was we were supposed to be working on. I had a caseload of over 20. There's not a snowball's chance I could remember what I was going to do with each of those people every time I was going to meet, unless I checked back in that progress note. So part of my process of keeping it intentional was to check to see what I said I was going to do last time and then do it this time and get it documented. What other thoughts does anybody have in regards to what being intentional means? Gosh, it's quiet.
It's crickets. It's crickets in the chat too.
Risa.
Okay. So I have a question about that. You said you had 20 plus, and did you pre-plan when you were going to call them and talk to them, or did you just wait for them to call you, or how did that work?
No, never wait for them to call, because the call may not happen. Yeah. And that's a really wonderful question. Part of what I did at the end of each session was I'd kind of summarize what we did. Here's what we did this time. What do you want to work on next time, Dawn? When you come in. And I would say, here's what I want to work on. And we discuss if it fits in the treatment plan, the plan that was developed once every 6 months or more frequently, if it changed more frequently. And so at the end of the session that I had with the person, I'd say, what are we working on next time? They'd tell me. I put in a little in my note, return to center, RTC is what we said, and a date and a time, and then a plan. Here's what we're going to work on next time. So that we had identified at the end of the session what the person was going to do the next time, maybe even with a little bit of homework. Dawn, I want you to take a look on Indeed and see if there are any jobs on there that sound interesting to you. and come back with a list of 3 of them. You know, maybe something along that line in regards to a plan and a little bit of homework. Jobs always work out better if the person is fully involved, as opposed to if we go out and get them for them. I've had more people, if I get jobs, and I did that once upon a time. It was goofy, but I did. I had more people that would object to this isn't right about it or that isn't right about it because they weren't actively involved. So encourage that active involvement as much as possible, and maybe give a little bit of homework on occasion to keep the person involved and part of it. Did that answer your question, Teresa?
That was very helpful. What does RTC stand for?
Well, at our agency, it stood for Return to Center.
Okay.
So return to the agency kind of a thing, or return, or, you know, what I'm assuming your agency will have, you know, your own acronyms. But if not, it's just a matter of when they come back. What are we doing?
Yeah.
And when are they coming back? And part of the reason that it's important to have in your record that here's the date and time they're coming back. What if I win the lottery tomorrow and take off and leave poor Darren behind and he has to figure out what he's doing with the person in my caseload? It would be nice. Yeah, one of those.
Yeah.
It would be nice to have that, you know, frame of reference of here's the last note and here's when the person's supposed to come back. So
right. And did you guys do case notes in a database or on a spreadsheet or Word document or?
Great question. And I think all different kinds of things are the way that people do them.
Okay.
What we had the great fortune of having access to in the agency that I worked for was an electronic health record. That electronic health record was accessible at any desk you went to when you logged on to the computer. It was also accessible to other folks working with the person. So I worked in a behavioral health agency. We had a team of therapists, a team of case managers, SUD treatment therapists, a variety of folks. If any of those folks were working with the same person I was, they could see my treatment plan and my progress notes so that they could dovetail their services along with what I was doing. So let's say somebody was extremely anxious. They had an interview coming up and were extremely anxious. Potentially the therapist would weave into whatever they were doing with them that session before, how to manage anxiety when you're going to a job interview. So that electronic health record was kind of wonderful. It can still be accomplished with paper records. It's just a little more cumbersome.
Thank you. That was very helpful. Thank you.
Good. So the what can we bill for? That's what Darren and I were discussing when we showed you the pre-employment, employment sustaining, pre-tenancy, tenancy sustaining, you know, contracted services with well points. Those are the kinds of, well point, I should say. Those are the kinds of things that you can bill. If ever you have a question about is it billable or not, think about how you're documenting it. Like the going to the food bank example. You got to make it clear why it relates back to supported employment or supportive housing. And then reach out if you're really not sure. I did a fidelity review of an agency that was billing supported employment for helping people apply for SSI or SSDI. That is not, nor will it ever be billable supported employment. Let me say it again. Helping a person apply for SSI or SSDI will never be billable to supported employment. I don't know, Darren, and I don't know if you know, if it in some fashion could be billable to supportive housing. I kind of don't think so.
You know, it'd be a stretch into financial planning or skills. You know, it's a critical need, but it doesn't fit our wheelhouse of trying to get people off benefits and people be more independent in the community like that. Definitely, if you had that correspondence where you're trying to find out what the SGA is or an overpayment, those type of things, yes. But that initial piece is more that it'd be a case management, you know, intervention.
Absolutely. Yeah. So if in doubt, check. Better that than losing money. Yes, Teresa.
Yeah. And one thing I think we've talked about too is like, why are you doing this for the person to kind of sit back and say, is there a barrier that the person is facing that needs some extra support? How come this person isn't doing it on their own? Sometimes they are capable. Sometimes, just like the food bank, I've helped people get going on the food bank so they have food at their job. Well, then I would pull back, or I'd check them at next day. I wouldn't have to go there every week for a month, to do that. It could be the case. There could be transportation. There could be some behavioral health issues. There could be a lot of things going on, but those would have to be addressed in the notes that saying why,
Well, and addressed in the
specifically.
swim lane of the person that's actually supposed to be doing them and can bill for them. Teresa, you had a question?
Well, we just had a case kind of similar to that came up. But in order to get housing and get that whole documentation, they needed the Social Security before they could even do the background check and stuff. So we had to help them get that. And standing in that line at great anxiety. So we had to send somebody to help walk beside that person. So
well, and let me clarify too. And granted, so the agency that I worked for had something called an informational note. There were certain things we could not bill for, but as Darren said, they're critical needs.
Yeah.
We had permission on occasion to do something that wasn't billed, but that we did a progress note, an informational note that had no billing component just because the person needed it for their next step. Another alternative to that is exactly what Darren said was, he didn't take people to the food bank every week. He passed it off to somebody who it would have been within their scope of duties, so they could bill for it.
Yeah.
That only makes sense for a lot of reasons. And so kind of keep those things in mind too. Is it a one-off thing that's relevant to supported employment or supportive housing that you can't bill for? Your agency will tell you whether you can do that or not. If it's a one-off thing and you're getting connected with another resource, well, it's that addressing barriers before a person gets started with services potentially. So this takes paying attention, being intentional.
Well, Don, we got a great question from Raven. I don't know if Raven, you're able to pop in and share. Are we able to bill when we sit down with a participant to complete an FCS assessment?
Okay. So my answer would be wrong, I'm pretty sure, because this is one of those things that WellPoint answers. I am so very thankful I don't have to be a subject matter expert in everything.
Right. We can share the wealth.
We can share the wealth. That's exactly right. So do please attend that WellPoint orientation or whatever it is they're calling it on September 10th if you're able, because that kind of thing will be answered there. And I know that's probably, you're hoping for a little more immediate answer. It's not too far down the road. It's next week. So,
well, Brian did share that a critical piece is getting that authorization. You really can't bill any services until you get that authorization from WellPoint. Don and I and Ness and I, we've done some trainings on completing that initial assessment. And if you have that person there going through some of the information and sharing that information, doing that advocacy, I could see that being tied in because some of the questions, I think housing had a lot more questions actually than the employment side. So definitely they have to be engaged in that process to do it. But if they're not engaged in it and you're just filling out the form, that would be really hard to meet that medical necessity criteria. So my favorite response is it depends.
Yeah, well, and I think, Darren, you mentioned housing. The housing folks had more questions because within supportive housing, one of the criteria is homelessness per the HUD definition. There's an attestation to homelessness, which is not something we have in supported employment. We don't have anything similar to that because we don't need to. But I think that one throws up a lot of questions for housing staff. So do please attend the WellPoint training. I think you'll find it incredibly helpful.
Well, it's been great. Some of the folks in the audience have been put in some of their experiences. So I think that's always helpful on the experiences that folks have. There was a new one. Brittany, this is a great question. Is there like a no-no list? Is there a list of services that we cannot bill for? Sorry, those are my own words. not Brittany's words.
We've called it different things, haven't we, Darren?
We have.
I think, is it this one or is it the FCS 101 that we have the no list in?
I think it must be the FCS 101 because we're just talking about that this week.
Yes, we were. And I get the two mixed up because we do both of those. And we were working on both PowerPoints kind of at the same time. So if you want more in the way of no lists, it might be later in these slides or it might be the FCS 101. I don't recall which, but we do have at least a preliminary no list. So there you go.
One thing that does come up is the separation of services. Under housing, there's no ability to bill for employment. They have to also be enrolled in supportive employment seed to do that. So you wouldn't want to wrap employment and housing together if you only have somebody in the housing program. So make sure that they both have both sides of the house because we really want to see that cross population between supportive housing and supportive employment to work together for that.
By the same token, I know we have some supported employment only agencies that will attempt to do housing things and bill them under supported employment. Don't do that. Not going to work well.
Things that make Don and Darren frown.
yeah, or cringe or whatever it might be, because we want you to be successful and we want you to get paid.
Yeah.
We're at slide 17, so we're halfway through and we got 40 minutes. Here we go. Do folks have additional questions about intentionality, or do you feel like you kind of have a handle on that?
Yeah, I think we covered most of this.
More than you might have otherwise already. Seeing anything, Darren? Okay, so I'm bumping to not even the next. Well, and here it talks about should be on the service plan, should be planned for the next time. That kind of thing. So I think we've discussed that. We'll discuss in greater detail to some degree in Golden Thread as well. I do like this slide from the standpoint of the plan drives service provision, and the plan is what the person has agreed to. So it gets us out of the role of figuring out what to do for them or with them. It's already written down if we're intentional. And it ends up being, as it says, less of the following up with and checking up on, because if they've been coming in and meeting with you, and if you have that plan at the end of every session, you know what you're going to do next time. You don't have to check up on, unless something, potentially, there were occasions when I checked up on folks just because I had heard through the grapevine that there always is that something happened with Darren and I'm worried about him. And so I would call and ask, how you doing? What's going on? Which, by the way, after I retire, I will continue to do to Darren because
ping me.
Yeah, there we go. So, there's certainly going to be some of that at any rate, but it does reduce just kind of the, not meaningless, but less meaningful kind of checking in just cause, and it's a more plan focused.
And it's also a great integration of those short-term and long-term goals because things change. Just be aware that you can make some of those changes so that your activities are reflecting what, the person needs.
Absolutely. And I'm not going to bother reading these to you. They are nice reframes of check-in versus something intentional. It was kind of like, picking things up and the question that was it, Rachel, that you had about the picking up some items that the staff person was then going to drop off versus dropping off Mary's meds, and that she wanted to discuss fewer meds. So it's that same thing you were talking about, then a conversation about kind of the stuff that was dropped off or next steps or whatever that would then be billable.
This one's a very wordy one.
This one's straight out of the Golden Thread. All right, cool deal. I see the thumbs up, Rachel. Thank you. This one's out of the Golden Thread toolbox that we now have from Rutgers that we're going to be training to. So might also be one that we're going to skip for the moment because now we're making some ground in regards to where we should be within the slide.
Yeah.
So as a new staff is being trained, or if you are that new staff and trying to kind of get under your belt What does this all look like? Ask yourself at the end of a session with a person, do I know what I'm doing with them next? Did we come up with that plan? Maybe make yourself a little cheat sheet that says, you know, before session, review treatment plan and plan from last session. During session, make sure session addresses the service plan. At the end of the session, make sure you've planned for the next appointment and that you've scheduled an appointment. I think that's a mistake that probably all of us has made early on is we get to the end of the session and maybe we forget to schedule the next one. And it's sure a lot easier if the person's in front of you than trying to figure out how to catch up with them otherwise. And Darren, I'm busy talking when this one's probably yours. I'm getting used to you answering the chat stuff while I'm doing stuff or talking.
Yeah, I'm going back and forth.
Okay.
I'll take the next one.
Okay. So then what outcomes are we working towards and how am I supporting the person? Heavily underline support, not do for, support, empower, choice, person-centered, all of those wonderful words that are wonderful words and mean they're still the driver, you are the support. How can I keep them engaged is one of my very favorite things. I went to a customer service training when I lived in Moses Lake and worked for the Behavioral Health Agency. There were a lot of us working with DSHS folks that were on TANF for Work First. They did DSHS put together a customer service training. One of the things that they made very clear is that each and every one of us can control our own behavior, and our behavior was a big part of what was going to keep the person coming back. Our behavior, the behavior of the person at the front desk, were they nice, pleasant, welcoming? Were they rude and made it very clear they were busy and didn't have time to spend time chatting with the person that's coming to the front desk? All of the paid professionals have a big impact on whether the person's coming back. We had what we called a 10-day letter. If somebody hadn't come in, hadn't responded to attempts to schedule for 30 days, we'd send them a letter that says, if you don't, contact us within 10 days, your file might be closed. I don't know about you, but it's not very warm and fuzzy sounding to me. And we realized that at some point. And we changed it even just a little bit and said, you used to come into appointments regularly. You're not now. I'm concerned about you and would like to know what's going on. I would love to get together. Well, not love. I would really like to be able to schedule an appointment to see how I might help you and to find out what's going on. Which letter would you rather receive? And does that impact engagement? Because I'm going to say it does. If you feel welcomed, if you feel that folks are caring about you, and we all do we do a good job of portraying that in an appropriate manner? So the word love, don't forget that I said that. That's wrong. I would like, it would be good, but truly showing that caring and that, you used to come in, now you're not. Please contact me. I'd like to know what's going on. And then the whole growth intent to support, not building dependence on the system, not building I'm doing your resume for you, but let's do a resume together so that hopefully the next time they apply for the job, they're confident enough in their resume building skills that they can do one on their own, or maybe with less assistance. So that growth intent should always be part of it. What else, Darren?
Well, I'm just thinking some of the things people have a lot of anxiety, like even doing, talking about job loss references, resumes, or they can't remember, passwords for multiple reasons. So I always found that they were really grateful if I could sit down and do a resume and say, I'm going to keep this stuff. And here's your password on my business card, to make sure that encourage them to do some of the engagement and access some of the information, as well.
Mm-hmm. Absolutely.
So this is kind of where really systems combine, because definitely when I started in behavioral health, focusing on the budget and some of the revenue goals wasn't always the forethought of my process. But definitely over time and growing in programs and more responsibility, it does pay, it does you have to pay more attention to it. It's one of the driving chords or anchors, for a program. And some of the things that, I really focused on my staff bringing in, from the IPS Learning Center and some of the tools they have is, looking at time management. How do we manage people's time? So what's the expectations? I was always somebody, coming in or for staff, really clear, set some of those expectations clear. Be an employment specialist, you're going to balance a lot of things. You're going to balance a lot of collaborative relationships with the people, with employers, with schools, resources, and you're going to be in the community. How do you feel about that? Is that something that you're able to do? We can provide that support to kind of get your time management set up and work on calendars and focus on time set in the community. I used to have weekly expectations for staff for that. And, using some of these other nuances like FCS, it's great to have that collateral piece that we talked about earlier. So even if the person's not with me, I can go out and check in with, landlords or with employers or schools to talk and advocate on behalf of the people that I'm working with, and really we just talk a little bit about some sort of engagement practices and, being sensitive to the people's needs and just sharing that I'm concerned about you. I haven't seen you for a while. Are things okay? Don, over in Spokane, they used to have the hot spotters. I can't remember what the group was, but a bunch
that's
of
exactly what it was called.
folks would come together. It's just like, man, I haven't seen Darren for a while. Where is he? It's just like, well, Bob would say, I just saw him on the street corner down the road. Well, maybe collectively we could do an engagement to kind of see how he is, because he hasn't been coming to appointments. Definitely some of those collaborative efforts or large organizations, you might have that. Some of the small organizations, that might be a struggle, but really kind of thinking of in new ways, how to engage with people to keep them engaged. But also, if things change and they start missing appointments, do we just do a 10-day letter? Do we want to do one call? One email? What does that look like? For some folks, we would do that because they would engage through email and phone calls. Other people, we would have to go to the homes and check in to make sure they're okay. And at the end of the day, it's just good business practices to show that we care about the individual, and we want you to be successful, but we also want you to be safe. And please, let us know how we can help you better. Maybe sometimes people said, I've changed my mind about employment, Darren. That's fine. If you ever change your mind, we'll still be here. This is how you can re-engage. Let us know how we can, help you. Job development is something that's really specific with IPS, and I think it's the core of any employment program. But it's that individuality that's the really focus. Are we making contacts in the community and bringing that information back to share some lessons learned? Maybe it's in the application process. Maybe there's some hiring issues. Maybe there's something just in conversations we've had with employers that could be really beneficial, or some information where the person said, geez, Darren, I don't know if I'm going to like that or not. And that's okay. Because I think people, as Dawn had said, we're looking for that buy-in to be successful, to put their best foot forward, to engage with employers, to make them a high quality candidate that an employer would want to hire. But this is individualized. This isn't through Indeed. It isn't through Monster. You can use some of those tools to do some education, but that's not job development for best practices. It's just not. And we still see some programs doing that. So we just encourage people to be really intentional services for employment, making relationships with employers, maybe through job fairs, whatever's going on in your community to really access some of those things.
Well, and I will say, when we talk about the IPS principles, so when you look at that fidelity scale, Teresa, one of the things you're going to see under job development, it talks about face-to-face, at least 6 contacts per week with the hiring authority. And I'm not sure it says on the scale or if it says in the manual, because there's a manual that goes along with that scale. The manual, if you look up, what is it called? Fidelity Reviewer Manual 4th edition in the library. It goes into greater detail for each of the items. And it talks about job development should be done face-to-face with the hiring manager, 6 contacts, at least per week kind of thing. And so when we're talking job development, that's what we're talking. It's getting out and being face-to-face with folks. I'm going to ask you guys to consider for just a minute. When we do virtual training, you don't have to answer me. Do you ever multitask? Is there a potential that maybe we haven't got all of your attention? My guess is yes, because I'm a human being too, and in virtual trainings, I've been known to multitask. If, on the other hand, we are in a face-to-face training situation, do I pretty much have your attention? Is it unlikely you're going to be multitasking, doing something else? It's a similar contact or concept, I should say, in regards to talking to employers. That virtual stuff, you're not building relationships in an effective way as opposed to face. And I know, so I have a boyfriend who did sales for like 30 some odd years. And I was talking to him, and folks will say job development is sales. It is. So it's almost everything else we do in our life when we're trying to persuade somebody about something. So I said to him, I went into this office of a hiring manager the other day, and she had gorgeous plants, and I love plants. And hers were also healthy. And I just asked her, I grow plants too, but yours look especially good. What are you doing with them? And he says, that's a sales technique. And I said, it is. It is. And it's a relationship building technique. And that's what we're trying to do when we're doing job development, is relationship building. Because the more that that employer knows and trusts you, the more that they know that you have their best interest at heart and the interest of the person that's on, the job seeker. So you're going to try and make a good match of both so that both win. So it is about relationship building. That's only one of many soapboxes you'll hear me get on. So maybe I better go to the next slide.
I think
Yes.
I think a lot of that really also depends on the person and their capability to kind of stay. Like, I like to write notes and listen at the same time. So it helps me retain the information. But I've had people also come in and, like they'll play on their phone and, look up and talk. And, it just really kind of depends on, ADHD or
So
anxiety.
you're saying they need that kinesthetic kind of thing to hear.
Yeah.
Yeah,
But I agree. I love the face-to-face myself too. But in this day and age, it's a little bit different. But and a lot of clients would prefer to stay in the safety of their home too. So it may take a couple of times to build that relationship to say, hey, let's meet up or something, for safety. So I know
what you're saying as far as different, but I'm going to share with you a statistic that I put in my job development training because I looked it up.
Okay.
80 some odd % of the jobs obtained are by networking. Which means individual contact with employers. 11% of jobs obtained are because of online job search. 11. So I hear what you're saying. And what I'm going to say is some of the stuff is still tried and true. You got to have the personal contact with an employer in order to build a relationship.
Is the person that is looking for the job networking with the employer, or is it your caseworker networking with the employer?
Either one or both. So there's one other fidelity item that talks about rapid job search. If you look up rapid job search, it talks about getting the person out in front of an employer within 30 days. It doesn't say for highest fidelity, so for a 5. It does not say get them a job in 30 days. That's not what it's about. It's about getting them out, getting them back into the community, getting them acclimated, maybe doing an informational interview, maybe do a practice interview, maybe do a whatever it might be. It's not about getting a job in 30 days. It's about getting folks out and getting them back into it within 30 days. It's kind of a respect thing. You said you wanted to go to work. Let's go work on it. Let's get started. Let's not wait 6 months where you go through resume classes and interviewing classes and this kind of class, and let's go do it now. And so it's about that kind of thing. And if you look at that one, and I'm trying to remember the other piece of it that I was thinking was relevant to what you're saying. And I've lost it. Ask your question again, Teresa, and maybe it'll flash back to
I
me.
think it's similar to housing. You make the connection, you get them out doing what they say they want to do as quickly as possible so
Yeah.
that they get familiar. I mean, in our world, we get a lot of resistance initially. What? I have to go look at them? Like, yeah, hello,
Yeah.
you're going to stay there, you know? You don't see
Fear.
things with a picture.
Yeah.
So,
Yeah, absolutely.
so
You know,
yeah,
folks will talk about people that don't want to work. Do you know why they don't want to work? Is it fear? Because a lot of the time it's fear. Either they've had a bad experience or they grew up in a family where their family members weren't successful in having long-term employment, or the person had a significant enough challenge or was surrounded by jerks that said, you can't, you're not going to be able to, you're never going to amount to anything, you're a piece of whatever. Um, is it, they're on their SSI, SSDI. It took months or years to get that, and now they're afraid to lose it. And by the way, with benefits planning, they don't have to. So it's a myth on the part of a lot of folks that going to work means I lose my benefits. Not necessarily, only if they want to. Is it, what else is it? Is it that my SSI is what pays the rent for the family? And they've told me I don't get to go to work, I have to stay home. So when I hear people say, well, folks, people don't want to work, rarely is that the case. More often, it's if you knew the backstory, it's something else that you can help
I
them
agree.
with.
Yeah.
So anyway, I don't know. I think I answered your question plus stuff you didn't even want to hear, but you're welcome.
You did. Thank you.
All right. So I'm going to just say that Golden Thread, that's next month. And I'm going to skip it this time. You've got this slide deck because Darren put it in the chat. Hopefully everybody was able to download it, but we'll discuss it in much greater detail next month. So I'm going to skip this one. And
that one.
potentially this one. And should I skip this one too, Darren?
Yeah, I think we've talked a lot about it already.
How about we go for this one?
Okay.
It's good.
You want to do that one, Darren?
Yeah, I always think about that this is a document, and there's some balances of, what's happening in this session, so you get some key components. But I would also do a lot of crisis intervention, so my notes could potentially be looked at in terms of civil detainment. So I always wanted to be, to the point, very intentional note taking, focus on what I needed to do that kind of reflected what was going on. And I think that's the same in terms of any note that we're doing. We're putting those characteristics in, not disparaging anyone or put them in a place where there's even more stigma, so to speak. But we, want to really focus on what the previous slide was looking at, the medical pieces, and I always incorporated something that the individual shared, as part of that feedback, because I really wanted to show that we were working together during this session and the person was an active participant, just not an active listener. And I know there were some sessions I had that because definitely some people would be preoccupied and I would share that, in the clinical note, but we really want to show kind of that engagement and maybe something that the person responded to about that. If I talked about certain type of employment or engagement with employers, what was the person's feedback? Was there buy-in? Or maybe you just learned about a new environment where the person said, no, that is not for me. That's fine, but that kind of helps build that roadmap, for the next one. It's just that partnership that we have, and I think that comes from meeting with people, in terms of getting some of the trust, so you can really find out some of the mechanisms that are going on that create choices or those choices that really make people more isolative and don't want to take any risk to change the status quo. And sometimes that could be the individual, that could be their supports, that could be multiple things going on in terms, because I've also had, well, my doctor said I can't do this. It's just like, okay, well, let's talk a little bit about that more. Sometimes there are medical conditions that we have to take very seriously and be aware of, or sometimes there's some education we have to do with some of our larger teammates in an organization. Yeah, be very respectful. It's courteous. I always focused on like next steps, and I always encourage my staff. What are the next steps? Do you have that appointment set up? Do you meet them every Tuesday, every second Tuesday, whatever that looks like, just to kind of create that a bit of routine, because I think that helps in some of the relationship building as well. But we want to build that stronger relationship, hopefully learn some new things about the person, or maybe we're going to learn about some of the barriers and maybe some of those barriers that stop people from thinking they can do something, thinking about change, or see themselves in a different perspective. Sometimes that can be really hard, that people just don't see themselves like I might see them being productive, autonomous out in the community.
Well, and sometimes we can help to foster that reframing, if you will, in the way we write things. Keep in mind that HIPAA says that our job seekers, participants, housing participants, whoever they are, they get to look at the record. They get to look at your notes. If I was to say Darren was non-compliant today, compliant to what? I'm not his mom. I mean, come on. And so, although I'm sure he feels like some days I act like that, but I am not his mom. So instead, is it Darren made a choice that didn't match what the suggestion had been offered? That's a matter of advocating for oneself. That's a matter of making a choice. That's a matter of, we all have theoretically that freedom. And so I think there's some of us that have been around for a while that got used to documenting in a very parental kind of way, which doesn't make any sense. We're partners, we're walking along this line together, and it needs to show that equality, that the person made a choice too, as opposed to was being non-compliant. That kind of thing, and recognizing, honest to goodness, and usually if you have like a larger agency have a medical records department that will sort of look at a file and maybe clean some things up before they share it with a person, only in relationship to would it be triggering and harm their mental health or substance use disorder kind of thing. So don't put things in there like that. Don't put things in there that have to be cleaned up because you worded it wrong. You know what I'm saying? I hope, anyway. Does that make sense, Darren?
Yeah, make it person-centered, because definitely
Yes.
when I came into the system, I used a lot of terminology like that, and I had it changed so it's more person-centered, more recovery language, more person-friendly language for folks. Because sometimes people would say, "Hey, I want to take a look at what you're writing about." Okay,
Yeah. Yeah.
let's set some time up, so that we can do that, or go through the medical records piece, to do that too. I think this is also a very critical piece, that the treatment plans really guide the work that we do. The notes are an important piece, because if there's a team, they're all providing that specific documentation, but it's really that driving force. And I've had to work with clinicians, say, hey, this is what we're working on employment. We really need that in the chart. Or, hey, the person changed their mind from work to school. We're going to be focusing on these type of activities. So whoever's engaging with that person, they're aware of, those changes. It's just like, and does the note match the services? There's been times when I did internal reviews that was not the case. So that we really needed to work as a team to make sure the services we're doing match what we say we're going to do. That's the driving force in terms of short-term and long-term goals. And definitely, there's that buy-in, because hopefully we're taking information from our participant and putting that in. So the job seeker is really saying this is what they want, and we're supporting, that goal. And those little steps that we're doing are going to help get the person, to that goal. Resumes, job search, or maybe it's just kind of doing some research online to find out about a job, to see, can you do these skills? Do you have physical stamina? Do you have, your license credentials to be a CDL? Maybe not, but maybe there's some ways we can get you there, that can guide, the process. So I'm not saying we have to kind of put 20 goals under employment, but I always worked in 2s and 3s. We want a couple things that we're going to work towards, earned income, and, education about, benefits, and our income will do some of that, about that. So definitely, I'm a believer, every time you encounter somebody, that creates documentation. Now, when you say, hey, good morning, Darren. Ooh, that's the note. What did you do?
It was meaningful.
Yeah.
Talking about the weather isn't.
No, talking about the weather, maybe talking about the weather and my dog, and then we're going to kind of have a conversation about how my mood is, right? But just saying, oh, my dog's good, 2 thumbs up, you could do that in a non-billable info note, but it's not really related to any medical necessity things, and it's probably not related to the treatment plan piece. Definitely my mood is important. I think your mood is important in anything we do, but in terms of the more medical guidelines, excuse me, it's really to focus that we're doing services that are meaningful and, really focus and do the support. I remember saying good morning and having small talk with a lot of folks that I never wrote down just because it was engaging, or waiting for somebody in the lobby to come. I'd strike up a conversation just to be supportive of somebody, or I could share that information with the case manager. Oh, better check. He said something about blowing through his old paycheck. You might want to follow up, about that during your session. And like I said, too many goals or plan, it can be complicated, and you're going to be doing a lot of work, and there's a lot of demand for paperwork. I'm not saying we want to make things burdensome, but we want things to be able to work and have some flow, and again, have that perspective on the individual, or maybe even their family, if they're involved too, or significant others. So things that support the individual to get to their ultimate goal. For us, it's employment or completing educational program.
It's interesting. I know both Darren and I share information from our background, things we learned from the other jobs that we had. And kind of a chunk of the learning that I did about documentation came from the Medicaid auditors, because I worked for a behavioral health agency for 21 years, and periodically there would be folks that would come in and edit or audit, I should say, our records based on that medical necessity. And so the Medicaid folks would actually come in and do that. Things that stood out in my mind that they talked about, making goals small enough that a person can accomplish them in 6 months, because it helps them to keep going. It helps to create hope. It helps to, look, you accomplished this goal. Let's go to the next one. That was from the Medicaid auditors. Making sure there aren't too many, just like Darren said, because the person becomes overwhelmed, which might then lead to becoming disengaged. Being very clear about what it is you're doing, not just saying, Dawn will get a job in 6 months. What kind of job? Full-time, part-time? What type? How much work is she doing on it? How much work am I doing on it? Being specific so that the person knows what part belongs to them and knows what part belongs to me and knows when they've met a goal. In part because of that factor of creating hope. Look, I already accomplished this, and I'm continuing to go. I'm making progress. So some of the most important lessons that I learned about documentation were from those Medicaid auditors, oddly enough. I bet you run into that too, huh, Darren?
They would see these goals, and how come they weren't addressed? I was like, wow, I didn't realize there were like 10 goals that we were addressing. So, that kind of feedback was like, well, we need to be a little bit more efficient and make things more doable.
Yeah. So progress notes, and we're going to get more into this about within the Golden Thread training. And I will say those Golden Thread trainings, it's a series of 6. There's so much. Golden Thread is so huge that for the next 6 sessions of that, so it's every other month, it's going to be a different topic within Golden Thread each time. So I will give at this point in time just some basics about progress notes. They got to be clear. They got to address the goal or objective. It's got to have the time, the location, those kinds of things have to be there for billing. And if your progress note isn't set up to have, kind of the billing, what amount of time, where was I, that kind of thing, it's something that's got to be built into your progress note format. You got to have the medical necessity in there. I used to say, if Uncle Bob could help you get a job, then Uncle Bob should go help you get a job. It's not Uncle Bob doing it because you need more help than that. So what are we doing that addresses the fact that there's a disability issue that causes more help to be needed? Interventions, job seeker response, Darren already mentioned that. I would put quotes from what the person said about what was going on. Wanted it to be very clear in my notes that we had an interaction. They were talking to me and some of the things they said. having said that, I didn't have the whole thing be a quote, but important things I would make sure to quote the person in the notes as much as possible. Planning, we've talked about a bunch. Homework, we talked about some. Being intentional, we talked about. So the follow-up and the agenda for the next encounter and all that kind of thing we discussed. I think we mentioned we were talking about that wonderful slide that Darren created and put in the chat, that there were links to some of these kinds of things. These are some of the important things that are suggested documents. I know that HIPAA journal, I'm wondering if Vanessa put that in related to housing, because I know that wasn't something I did. Or did you, Darren? Is that something you put in?
No.
I think that must have been Vanessa with housing then. HIPAA shows up anytime, or it should show up anytime you have an interaction with someone other than the person you're providing services to, or other than one of your colleagues who's also working with the person. You're allowed to talk to your colleagues. You're allowed to share with your colleagues if they're also working with the person. I know the agency that I worked for and the electronic health record actually had firewalls. So let's say Darren's receiving services from somebody in the agency, and I want to see what's going on with Darren, but I don't work with him. That firewall would prevent me from looking at the documentation. If, on the other hand, Darren's working with a case manager and I'm the employment specialist for him, that firewall would be down. I don't know. I can't come up with a better word for it, so that I could see what was going on with Darren, because I'm also working with him. So HIPAA shows up in a lot of different ways. We talked a little bit, I think, about disclosure in the disclosure form. That is not a release of information. HIPAA requires a release of information with various components, and you can look it up, or the DSHS example, if you look up online, DSHS release of information, it's very HIPAA compliant. The release of information has to be signed anytime you're going to share protected health information about a person on your caseload with someone else, whether it's their family member coming into the appointment, whether it's an employer, whether it's, maybe you're the supported employment agency, but they're working with a therapist in a different agency. Anytime you're going to share protected health information, and what's included in protected health information? Everything: name, address, phone number, provider one number, picture of the person, gender, potentially. I mean, the list goes on and on and on as far as stuff that's considered protected health information. So we mentioned job development earlier, pardon me. And folks would say, when I talk about release of information, oh my God, do I have to do that every time I talk to an employer? No, not if you don't share protected health information. So I would talk to an employer and say, hey, I'm an employment consultant. I'd like to hear about your needs today. What kinds of people are you looking for in regards to employees? And I might then say, I have a group of individuals, job seekers that I work with that have a wide variety of skills and abilities. I have a couple in mind that I'm thinking of that might be a good fit for your job. Here are the characteristics of one of them. Here are the characteristics of another one of them. That would not be protected health information, as long as it's not something that the employer would say, oh my God, I know what you're talking about. I actually had that happen once in a training. I shared one of my favorite stories about a person in Spokane, and the person was from Moses Lake, and somebody in the group said, oh my gosh, I know them, and yada, yada, yada. It's like, yes. So if it's anything that will identify the person, don't share it. But if you're talking to employers on behalf of individuals and you have somebody in mind and you can share, they're hardworking, they're very punctual. I found them to be innovative. They ask great questions. Do you know who I'm talking about if I say that? No. So you can do that kind of thing doing job development. But then when you get to name, address, and all those other things, then you got to have the release of information.
Yeah, one thing I would just add that sometimes in small rural towns, people kind of
Oh,
know
yeah.
people. And I think there's just that extra sensitivity that I learned through doing some trainings with Dawn in Eastern Washington, that some of those things have come up. So I would say definitely, don't, generalize because, there might be some nuances that you're not aware of, but a community would because one person said, well, so
Here's
and
the
so
ring.
went to school, junior high, high school, and was a known member of the community of having some challenges. So just be sensitive, to that. And then
Intentional.
yep, be
All the other
sensitive.
documentation.
And if you plan on handing out a resume, make sure you have that signed ROI.
So I'm going to go back. Darren, do you remember, do you have the link to the documentation guide in that new list that you did? Or do we
Yes.
maybe need to? Okay, groovy. All right. So early on, so back in 2018, when we first started, or actually 2017, we anticipated there were going to be a lot of folks that might not know about Medicaid documentation and just, treatment plans and things like that in general. So we had a documentation guide put together, so a written booklet that gives information about kind of the different components of Medicaid documentation. It's not, doesn't necessarily say golden thread per se, but it has a lot of those concepts in it. So one of the links that you got in that resource list that Darren shared was in fact, excuse me, that documentation guide. So where we're at, we do a boatload of trainings. But over and above what Darren and Anessa and I do, Rutgers University is going to do 53 trainings between now and June. So we, meaning the bigger we, the team has access to a lot of trainings. AHP, Advocates for Human Potential, is going to do, probably more than one training. Other entities may be doing some training that would be of interest to you. If you have not signed up for our FCS newsletter, please do, because that's where all of the announcements come out related to training coming up and registering. We have a couple, when it says Fidelity Review Learning Collaborative, we have what's called the Supported Employment Coordinating Committee. And by the way, Darren, I haven't had that put in the newsletter yet. Smack me upside of the head if I don't remember to do it in the next couple of days. And I'm glad you live far from me, so you can't actually do that, but you know what I mean.
I hear you have a hell of a counter swing, Don.
We have a supported employment coordinating committee where folks who have an interest in supported employment can meet with us monthly and we learn from each other and we share information about what's upcoming and that kind of thing. That'll be in the newsletter if you're interested in attending. We have a supported employment fidelity reviewer learning collaborative, where those folks that want to be on the reviewer teams come in. We do some training and we do some conversing and planning and that kind of thing. So when we talk about that fidelity review learning collaborative, every one of you potentially could be part of it. If you're interested in being a reviewer, we're working on developing groups of folks to be reviewers in the future. If you want to host a review, we've got reviews that will start happening. I'm not sure when, probably beginning of the year. I'm thinking it won't be before then, but I don't know that for certain. So that learning collaborative, that's the way that we've addressed fidelity in general, is let's learn from each other, let's learn from experience, and let's communicate with each other to make it better all the way around. One of the things that we've got in Spokane that's kind of a part of that Fidelity Review Learning Collaborative is we started an FCS coalition. Any FCS provider is welcome to attend, and as are supporters of FCS, kind of the, like folks from DVR could come or things along that line, with the intent of collaborating more and working together and being supportive of each other and recognizing that if a person in a program isn't doing well in that program, maybe one of the other ones in town is a better fit for them, and making that referral. We all want the best for the people that we serve, and that's a piece of it too. So anyway, lots to that learning collaborative. What am I forgetting, Darren?
No, I think you hit them all, Don.
Okay. You'll notice that Anessa's on here. Anessa has two kiddos, an infant and a little guy that just started, I think, preschool. He started preschool today. That's a pretty doggone good reason to miss doing the training today. So, she posted a picture. God, he's adorable. So cute. So anyway, here's your contact information. Always please feel free to reach out to us if you have questions, if you need some individualized training, if you missed a training link someplace, you've heard something's coming up, but you haven't seen it or whatever, feel free. Anybody have other questions, comments how much time have we got? Oh, we're over time. But you know what? If anybody has questions they want to ask, I'm willing to hang out for a few minutes.
Looks like somebody did ask for something documentation for UA for SUD services. Definitely, I know there are some specific forms around that. I don't have those, but we can reach out. If you email us, we can reach out with our team to get a little bit more information on the SUD side of the house. Great question. Thanks for sharing that one.
I will say there's degrees of HIPAA, if you will, and probably the most restrictive degrees, if you will, are related to folks with substance use, with HIV, slightly less so with mental health, and kind of so it goes. So most stringent, I think, are the SUD and kind of HIV things. So yeah, we definitely have colleagues that could help with that. Other questions, comments?
Just reminding folks to reach out individually to Don and I about the WellPoint training next week.
Excellent. Yeah, good reminder. Thank you all for being here. Gosh, this was a great crowd today. We had lots and lots of folks here, and hopefully it was helpful. All right, and I think Darren,
Thanks,
you probably
everyone.
put in your thing too, didn't you? I don't know if we're still recording. Crystal, are